My name is Paul. I've been diagnosed with AS for around about 8 or 9 years. I probably had AS for a lot longer than that, but I've been diagnosed for around about 8 or 9 years. I first started to notice symptoms when I was around about 12 years old. I went to the GP at around that time, who said I was probably a little bit overweight. It was probably growing pains. He referred me to a specialist at around about the age of 15 after a lot of toing and froing from the GP. It was at this point that I was getting a lot of hip pain, a lot of lower back pain. Just going back through school years, I remember playing a lot of rugby, a lot of football, a lot of cricket, and feeling, intense periods of pain, and only being able to get through that with, painkillers and a lot of massage and treatment. But it was only when I got to university at around about the age of 20 when I collapsed on the rugby field, and the pain just became too much. I remember crawling off the field that day and saying, enough's enough. I went back to the GP and said, you need to refer me to someone other than an osteosurgeon. And he referred me again to an orthopedic surgeon. And at that point, he said, I don't think there's anything you can do for me. He can do for me, but would I mind seeing his colleague in the hospital? And I said, yeah, not a problem. Didn't know I was seeing a rheumatologist at the time. She picked up my notes and said, I think you may have AS.
My name is Poppy. I'm in my 50s. I have 4 children and I am a nurse. I first noticed the symptoms of what I now know as axial spondyloarthritis in my late teens, around 18. The first symptom I had was knee pain, which was put down to all the sport I played, and then I developed quite severe back pain. At this stage, I'd started my nursing degree, and I was told it was due to lifting patients. I went to see the GP, and he just advised me to be careful when I was lifting patients and to take paracetamol. I continued to live with this low back pain for many years after that, and it became very severe when I was pregnant. And I had 4 babies in 5 years, so I suffered with severe low back pain to the point where I couldn't walk, and I had to use a walking stick through my pregnancy. I was seen by, obviously, the gynaecologist, the obstetrician, and the physios, and they treated me with manipulation, spinal jackets. And after I'd finished with the pregnancies, I continued with the low back pain. At this point, I still had no diagnosis because I just thought it was unfortunate that I had developed a severe sacroiliitis during my pregnancies. The pain continued. I continued to exercise and do everything that I thought I should do until I got into my early 30s. My ex-husband, who was a doctor, suggested I saw a rheumatologist, and I would say I was about 33 when I was finally referred to a rheumatologist. The rheumatologist then did some blood tests, confirmed that I was carrying the HLA-B27 gene, and that I had some X-ray changes in the sacroiliac joints, and he decided I had the axial spondyloarthritis.
When I was first diagnosed, it was such a huge feeling of relief. I think some of the darkest days I experienced before my diagnosis was not knowing what was wrong. So many people said so many things could be the problem, but having finally received that diagnosis, it meant that I could then begin on a course of action.
If I was to give advice to any person who was suffering from low back pain, it would be that it is not normal in young people. And I would advise most people to go to the GP straight away, because it is important to get an early diagnosis to prevent, that inflammatory process causing more damage to the body. Once you have a diagnosis, you feel much better because you know what you're dealing with, and this will help you manage your disease. We know it's a disease for life, but it's not all doom and gloom. There are plenty of treatments out there and things to help you manage the disease so you can carry on with a normal life.
I look back and don't think that I could have really done anything different, because it's very difficult for a GP to diagnose and to refer you to the right person. But again, I just wish that irreversible damage hadn't occurred. Hence why, as soon as I saw the symptoms in my brother, I pushed him towards seeing a rheumatologist straight away. And that diagnosis period, which was 15 years in myself, was brought down to sort of a year, 2 years in him, which meant that there was very, very little irreversible damage in my brother, and he's able to lead a much more active physical life than I am.
I have children who have the disease. I have 4 children, and 2 of them have had a diagnosis. And one thing they said to me is how frightened they were, like I was when they got their diagnosis, that they would end up with a fused spine and in a wheelchair too. So when they met other young people, when they came to the events, it was really encouraging for them to see that, you know, here's their mum in her late 50s, still managing her disease, not with a fused spine, not in a wheelchair, and managing to live her life.
As a GP, diagnosing axial spondyloarthritis can be really difficult. Most people will develop back pain at some stage in their lives. We know 80 to 90% of us will suffer with back pain. We know that the symptoms of axial spondyloarthritis often form a small percentage of that, so picking those out can be really difficult. If I was concerned about axial spondyloarthritis, I would ask 5 key questions. The first one is easy. What's the patient's age? We know that axial spondyloarthritis is much more likely to start in patients under the age of 40. The second one is about sleep. Axial spondyloarthritis commonly causes back pain at night, but this isn't pain when you first settle down to sleep. It's pain that wakes you up in the second half of the night. Patients often talk about the witching hour, the hours between 2 and 5 when the pain and stiffness wakes them up. The next key symptom is stiffness in the morning. Stiffness in the morning is common with back pain, but pain due to axial spondyloarthritis is really intrusive, and it lasts for longer than 30 minutes. The more you use your back, the easier the pain gets. It also tends to cause pain that worsens with rest. As you sit down, rest or lie, the pain tends to get worse, making you get up again. Using those questions can help me work out what's causing a patient's pain. There are some other things I might ask as well. I'd want to know about the patient's medical history. Do they suffer with some of the conditions that are associated with axial spondyloarthritis? Skin disease, such as psoriasis? Bowel disease, such as ulcerative colitis or Crohn's? Or eye disease? This is commonly called uveitis or iritis. Diseases in a patient's family are important too. I know that if they have a family member who suffers with axial spondyloarthritis, they're more likely to suffer with the disease. The same goes for the similar conditions, such as skin psoriasis, iritis or eye disease, or inflammatory bowel disease. These features can help your GP, but they're not there for everyone. I think if you're concerned, the best thing to do is to talk to your GP and talk through your symptoms.